Well, this is a great meeting for ovarian cancer this year. Obviously, the 3 presidential plenaries are looking at the role of PARP inhibitors in various different settings. So there's the VILIA GOG 3005 trial I just mentioned. There's the PALA-1 trial, which is looking at the contribution of olaparib to bevacizumab. Many of your listeners may know that paclitaxel carboplatin is given with bevacizumab based on the support of ICON-7 trial in the EU and the GOG 218 trial in the US. And so this was a relevant topic because we weren't sure whether or not we could add olaparib safely, or a PARP inhibitor safely, to anti-angiogenesis therapy in the maintenance setting, and so we'll see today is that that's an efficacious route as well. And then in the PRIMA study, what we've seen is that we can expand the cohort away from these biomarker-defined groups such as BRCA and HRD to essentially include this patient population, a broader patient population that benefit from a PARP inhibitor, in this case niraparib. So for ovarian cancer frontline therapy, dramatic changes. 2 new PARP inhibitors in new settings, and then the addition of a PARP inhibitor to an anti-angiogenesis strategy. So that's very exciting. In the recurrent space, we're going to hear about FORWARD-1 trial, which is looking at mirvetuximab, which is an antibody-drug conjugate that tagged to folate receptor. Now, this trial was a phase 3 that was ultimately negative, but it showed some significant activity, particularly in the biomarker-positive group. And this has led to the intent to actually restudy this population in a more well-defined study group. So this is an active compound that was going to be rebooted as another phase 3 trial to help patients in platinum-resistant setting. And then I don't want to miss the opportunity to highlight the merits of GOG 281. So this is a phase 3 trial that's looking at a rare ovarian cancer subtype called low-grade serous ovarian cancer. And we know historically that chemotherapy has not been a very active compound or strategy in that disease, and this is a disease we often frequently use endocrine therapy. And so what we looked at in the study was to compare a MAP kinase inhibitor, or a MEK inhibitor, because of the frequent alteration of the MAP kinase pathway, versus physician's choice chemotherapy or hormones. And what we showed in this study, as you'll see, was that there was a significant benefit in progression-free survival and an objective response for patients getting a MEK inhibitor. So now we're introducing a completely new class of drug to a rare ovarian cancer subtype. So again, tremendous meeting for patients with ovarian cancer.